Hi, my name is Tracy Whaley, and I will be talking to you about the World Health Organization, or WHO, and malaria. So, the World Health Organization is the United Nations agency that connects nations, partners, and people to promote health, keep the world safe, and serve the vulnerable. It was founded in 1948, and the headquarters are located in Geneva, Switzerland. There is a director, and they serve a 5-year term. And this particular director was elected in May of 2017 by the 194 member states. That is Dr. Tedros, and he is actually the first person to be elected from the World Health Organization from the African region. And interestingly enough, he returned to Ethiopia after his studies as a malariologist and then served as Ethiopia's Minister of Health and Minister of Foreign Affairs. So within World Health Organization, there are 6 regional offices located in 150 plus countries around the world. There are 194 member states that convene annually in the World Health Assembly. All of these regions have regional directors, and they all work together to implement strategies across the organization. That World Assembly that I just told you about is the World Health Organization's highest level decision-making forum, and they meet annually. There are delegates from all 194 member states, and they convene to set priorities and set goals for global health progress. Values are the professionals are committed to integrity and excellence in health. And these they adhere to the United Nations values of integrity, professionalism, and respect for diversity. They reflect on principles of human rights, universality, and equity. They have vision that everyone attain the highest possible level of health. They promote health. They keep the world safe. They protect the vulnerable, and they are committed to putting these values into practice. The CDC talks about malaria and how it is caused by parasites, and those are transmitted to people through the bites of a female mosquito. There are 2 species that pose the greatest risk, and those are Plasmodium falciparum and Plasmodium vivax. Malaria is preventable, however, and curable, and thank goodness it is not contagious. Most of the cases and deaths occur in the sub-Saharan Africa, with other big cases located in Southeast Asia, the Eastern Mediterranean, Western Pacific, and the Americas. In 2019, there were 229 million cases and 409,000 deaths. Children under 5 are the most vulnerable, and more than 260,000 African children die under 5 each year. In an article I read about Nigeria, they reported 100 million new cases annually. They say the highest risk are the children, of course, and then also pregnant women. In Nigeria, they account for about 25% of the 19% of deaths in the world. In the United States, actually, there are 2,000 cases diagnosed every year, and thankfully, those are usually travelers and immigrants that are coming back from countries where the transmission actually occurred. But again, malaria is not contagious. So like I said, they are caused by a bite of an infected female mosquito. That parasite is found in the red blood cells of those infected. And therefore you could get infected through blood transfusions, organ transplants, sharing needles, and even during delivery from mom to unborn child. Symptoms of malaria: high fevers, shaking, chills, and other flu-like symptoms. Thankfully, there are initiatives, even though the numbers are still quite astronomical. The Global Malaria Program. They control the World Health Organization's efforts to control and eliminate malaria. Their work is guided by the Global Technical Strategy for Malaria 2016 to 2030. They are supported by the member states. They are led by Dr. Pedro Alonso and then numerous others on the team. There is the Malaria Policy Advisory Group. They provide advice to the World Health Organization on all technical areas relating to malaria control and elimination. They meet twice a year in Geneva, and they do recommend the malaria vaccine, RTS-S/AS01. So let's talk about that vaccine here. It does act against that most deadly and prevalent one in Africa, that Plasmodium falciparum. The World Health Organization recommends that children get that. There was a 2-year pilot program that, it's still going on in Ghana, Kenya, and Malawi that started in 2016. They're suggesting that 4 doses be given to children starting at the age of 5 months, considering possibly 5 doses given seasonally in those areas where there are seasonal peaks. I guess that pilot is going to continue through 2023, and they'll be looking at data about that value of the 4th dose and maybe the long-term impact of children's deaths. Thus far, there have been 2.3 million doses given, and they're doing that through the Child Immunization Platform. The next steps will include funding decisions for a broader rollout and whether or not to give this vaccine as a national plan. It is funded by 3 global health funding bodies: Gavi, the Vaccine Alliance, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and UNITAID. Some other initiatives: the pyrethroid-only long-lasting insecticidal nets. So these are used to prevent and control malaria in children and adults living in the areas where there's ongoing transmission. That is a strong recommendation, has high certainty evidence, and of course it's most effective at night when the mosquitoes are biting and people are under their nets while they're sleeping. There's the pyrethroid PBO nets, and those are used where those malaria vectors exhibit resistance to pyrethroid. And then this talks about the mass distribution of those nets to everyone. Continuous distribution. They're using antenatal care clinics and expanded program on immunization. People are advised to keep the nets that they have until they are replaced, regardless of condition. If there's holes in them, they need to keep using them until they're replaced, because some protection is better than none. Also, indoor residual spraying, and this prevents and controls malaria in children and adults where there is ongoing transmission, and there are other initiatives as well. So a couple social determinants of health that I found, and they kind of coincide with each other, which a lot of times I find that many of them do. So healthcare access and quality, and socioeconomic status and poverty. So looking at this, people who can't get access to healthcare, they don't have health insurance, or they can't afford health insurance. They live quite a distance from a healthcare facility to get those initiatives. As far as socioeconomic status, a high percentage of people do live in rural areas, farmers and traders as far as occupations, and they possibly cannot afford health insurance. And then here are my references, and that is it. Thank you.